What if I told you that some of the strongest pain medications in humans may barely work when you give them by mouth to dogs? Let's talk about the science behind oral opioids in veterinary medicine. Opioids relieve pain by binding to opioid receptors in the brain and spinal cord, particularly the mu receptor. When these receptors are activated, the pain signals are suppressed before they ever reach conscious perception. So in people, oral opioids like oxycodone and hydrocodone and morphine and codeine, they're commonly prescribed. Dogs, however, are a very different story. The biggest problem here is pharmacokinetics. The effectiveness of an oral opioid depends on two things: how much of the drug gets absorbed into the bloodstream and whether the liver destroys it before it reaches circulation, something known as first pass metabolism. Dogs metabolize many opioids much more rapidly than humans do, and some drugs have extremely poor bioavailability in dogs, while others are converted into inactive compounds before they can even provide meaningful analgesia. Let's start with morphine. It's an excellent injectable pain medication for dogs, but orally, not so much. Dogs have extensive first pass metabolism, meaning most of the drug is broken down by the liver before it ever reaches the bloodstream. And as a result, oral morphine is rarely used in dogs. The verdict here: poor choice orally. Let's talk about codeine. Sounds appealing because it's available as a tablet. The problem: codeine itself is actually a prodrug. It needs to be converted into morphine by liver enzymes. And dogs are extremely inefficient at making this conversion. So many dogs generate almost no active morphine from that product at all. Numerous pharmacokinetic studies have shown that plasma morphine concentrations are often far below therapeutic levels in dogs. The verdict for this drug: evidence is meaningful, pain relief is weak. Tramadol. This one surprises many people. For years, tramadol was one of the most commonly prescribed pain medications for dogs. But dogs rapidly metabolize tramadol differently than humans. The metabolite responsible for most opioid activity is produced in relatively low amounts, and the parent drug has only weak affinity for opioid receptors. Multiple clinical studies have failed to demonstrate meaningful benefit for osteoarthritis when tramadol is used alone. So today, many veterinary pain specialists have largely moved away from tramadol for chronic musculoskeletal pain. Verdict for this drug: limited evidence for most orthopedic pain. Now, hydrocodone is an interesting one. Veterinarians primarily prescribe it as a cough suppressant rather than a pain medication. Although it does have some opioid activity, there's surprisingly little clinical evidence supporting its routine use as an oral analgesic in dogs. The verdict: better evidence for cough suppression than for pain control. Oxycodone receives a lot of attention because it works really well in people, and dogs do absorb it, but studies have shown oral bioavailability is highly variable across dogs. Some dogs achieve therapeutic concentrations, others don't at all. So the clinical evidence supporting routine use remains fairly limited. The verdict here is that promising pharmacology, but limited clinical evidence. Buprenorphine is an interesting one. It's one that's one of the safest opioids that we use, but the oral tablets used in humans don't work well in dogs because the drug is swallowed and destroyed during first pass metabolism. So instead, veterinarians typically administer buprenorphine by injection. Unlike cats, dogs absorb very little through the oral mucosa, so simply squirting buprenorphine into the cheek pouch is generally unreliable. Verdict here: excellent injectable opioid, not a reliable oral one in dogs. So opioids remain extremely valuable, but they're often far more reliable when given by injection in the hospital than by a tablet at home. Oral opioids sound like they should work the same way as they do in people, but dogs are not little humans. Their metabolism changes the equation completely. And understanding those pharmacological differences help us choose treatments based on evidence, not assumptions. Follow me for more evidence-based veterinary medicine.